Hello and welcome to the Integrative Health Convention 2019 online interviews. Today we're going to find out more about reflexology, what it is, and what the evidence is from Tracey Smith, who's speaking at the Integrative Health Convention 2019 at the Plaza, Victoria in London on the 5th and 6th of October. So this is Tracey Smith. Hi, Tracey.
Hi.
And she's the head of reflexology support and research at the Association of Reflexologists. They are a membership organization that primarily supports their members, but also aims to influence on behalf of reflexology through a variety of means. They can be found at www.aor.org.uk, and I'll put the links below. Hi, Tracey. Should we begin by letting the audience know a little bit more about yourself and what you do?
Sure. So I'm head of reflexology support, but I also do research because as my job prior to becoming a reflexologist, which I will explain in one of the other questions, I was actually a scientist. So I'm very interested in the concept that there is research out there and that we need to track it down and we need to integrate it into our therapy. Reflexology is a complementary therapy. So it's complementary in as much as it's supposed to be able to be run alongside standard healthcare, and it's reliant on the theory that there are points in the hands, the feet, the face, and actually the ears as well that reflect areas of the body. And by applying specific techniques, similar to massage, but not quite the same, we aim to rebalance the body, to make the body work more efficiently and more effectively than if it didn't have the reflexology. As an organisation, we are there specifically to support our members, but also we are out and about, as I said, trying to influence on behalf of reflexology, which is a bit of it's a very soft therapy. It doesn't have the same strength of research behind it as does acupuncture or herbalism or some of the other therapies, osteopathy, for example. So we are a slightly more orphan type of therapy, if you like. So we're out there pushing for understanding as far as we can across all boards.
And can you tell me how you got interested in what you do now and the story behind how you got started?
Sure, it's actually a very interesting story. I often tell this story. I was a scientist. I'd worked in everything from heart and kidney transplantation, bone marrow transplantation, immunology. I was a research assistant, so I hadn't got a PhD or anything like that. And I was a little bit bored with my job, and I thought I'd kind of like to do an evening class. So went along to the local college with my money in my hand to pay for wine tasting, and wine tasting was full. Apparently wine tasting was always full. So I said, what have you got on that day and that time? And they said, well, we've got reflexology. And I said, fine, I'll do that. I knew nothing more than the fact it was based on the feet. And I did it. It was a 12-week introductory course. It was just a couple of hours. We were utter novices. I mean, I at least knew where things were in the body. A lot of the people in the room didn't. And we started by learning tiny little parts of the foot sequence. And by the end of the 12 weeks, we were doing the whole foot sequence. But what I found was by the end of the 12 weeks, some of my minor health problems had disappeared. And one of those was actually migraines. And I trained 23 years ago, actually, with that introductory course, and I haven't had a migraine since. And okay, that was just the effect that it had on me, but in understanding that that was the effect it could have on me, it meant that I wanted to go off and learn to be a practitioner and have similar effects on other people, I hoped. And indeed, that has been the case.
And that's interesting. In October at the Plaza at the Integrative Health Convention, you're going to talk about reflexology, what it is, and the evidence for it. Can you tell us a little bit more about this topic and what the audience will get out of it?
Sure, yeah. So for some of your audience, reflexology will be no more than a pamper treatment that somebody goes and has a spa for the weekend, you know, or for a day. Reflexology is so much more than that. Yes, it does potentially primarily work through the relaxation response, but it does a whole lot more. And so what I'd like to do is I'd like to explain what reflexology is, explain some of the potential from other areas of science, such as discriminative and effective touch, and then also bring in some of the studies that have shown very positive results that could also underpin some of that integration function. So, for example, there's a study that showed that reflexology helped with reduced both pain threshold and pain tolerance in acute pain. Now, while that is a standalone, relatively small study, it's a brilliant little study, but it's relatively small. If you're thinking about the bigger picture of people having pain, full stop, if you can help reduce their, increase their tolerance rather, and increase their pain threshold, then suddenly they need less medication. So the studies that we have in reflexology are sort of underpinning ones. They're not massive by any means, but they're there. And that's what I'd like to talk about.
Wonderful. Having thought about the Integrative Health Convention, where the audience will be made up of doctors, therapists, and the public, where do you see your particular practice fitting in with integrative health or holistic health?
Okay, well, already there was a study done in 2009, and it stated that 62% of cancer units already had reflexology. So we're already potentially semi-integrated, but only in one tiny area of health, that being the cancer care arena. Actually, I think now, 2019, with loads more, many more than 62% of cancer units will be offering reflexology, albeit not necessarily by a paid therapist. A lot of that provision will come from volunteer therapists. However, you know, if it's accepted in that area of health, why is it not accepted in other areas of health? And I think the key area that reflexology can help with are those effectiveness gaps, where there isn't something that you can just provide, whether it be a drug therapy or a bandage type therapy. Specifically there, I'm thinking lymphedema, that maybe reflexology, working on an individual level for individual patients, could help dramatically. But until we get the research to show that, there's seemingly no interest in allowing reflexology in other areas of health, even though it's fine in cancer care. So what I'd like are the participants of the conference to come away with is to think, actually, do we have an effectiveness gap in our area of care? And if there is, could there be a space there for reflexology? It's very low, it's very high safety, it's very, very well accepted by all sorts of people from all walks of life and all age groups. That's the other thing, babies can have it all the way up to end of life care. And so there could be many areas of effectiveness gap where reflexology might come into play, and that perhaps we can set up some sort of research or data study to find out if it does work.
Thank you. So I'm asking one particular extra question, and that as a therapist with years of experience, what do you think in particular is the key to healing in what you do?
What I do personally, I think reflexology is an incredible therapy, but obviously people apply it quite differently. I think the reason my clients come back to me over and over and over again, which they do, in fact, one chap I've been seeing for 20 years, is the fact that they have a very strong therapeutic relationship with me. And I think with all complementary therapies, that relationship is really, really important. I think we used to have it in medicine and not so much anymore. And I think the complementary therapy relationship has potentially taken that role. And so they come to see me. Yes, they come to have reflexology, but they also come because it's me. And so on a personal level, it's to do with that relationship I have with my clients more than anything else, I think.
Yeah, I can't agree more. I think there's a lot of evidence for continuity of care, and we're very fortunate. I'm very fortunate in Devon to work in a village practice that I can have my own patients and they come back and see me over the years. And you develop such a strong relationship with the patient and their family.
Yeah. Whereas I live in London, no continuity.
I know, things are difficult at the minute. So thank you very much, Tracey, for taking your time, and everyone else for taking your time to watch and listen to this. So remember to get your tickets early now from our website. We are the Integrative Health Convention at the Park Plaza Victoria in London on the 5th and 6th of October 2019. You can use the discount code video5, which will give you a 5% discount as a gift from us to you for sharing your time with us. So when we see you in October in London, you get to meet Tracey, myself, and all our other amazing speakers. There are over 30 speakers, and these interviews will help you choose which talk to attend from all those. Thank you.